All right. Thank you very much. I'd like to recognize the presence, I believe, of the president of the Dental Association and the vice president, plus other esteemed members of the dental fraternity. I'd like to also thank you very much for the opportunity to share some thoughts and experience patient retention. I'm really going to, I hope what I share this afternoon will be more of talking points and give an opportunity to for us to discuss, because we all have experience, varying degrees of experience. I began seeing patients in the 80s as a student. I'm glad to say some of the patients I saw as students I'm still seeing now, almost 30 years later. I've lost many patients along the way. I have also made many mistakes. I've learned from my mistakes, and I'm sure that will be true of most of us on this platform. So I would like to just share a bit, and there are three main things in terms of the outline. I'm going to talk about first of all the importance of patient loyalty. That is something that I'll address, and then I'll also like to address why patients leave. Some studies have been done on this. Why do patients move on? Yeah. If we are aware about this, it would help us to some of the reasons why patients leave. So I just my power might be running out soon, so just excuse me 1 minute. I make sure my power doesn't run out on us. Just 1 minute. Okay, thank you. I'd ask the admin to help mute the mic so that we don't get too much interruption from other things happening wherever you are. Okay, and finally, I'll talk about some tips that we can have as we, that can help us have greater patient loyalty. Okay, so let's get going. Let's begin by defining patient loyalty. This has been defined as the act of choosing one doctor or one dentist services consistently over the others. This can happen between practices where somebody moves from practice to practice, but being in a situation where I have a number of dentists working together, I also see that this loyalty can even be within a practice, whereby a patient prefers one service over the other. And by the way, once loyalty is there, it doesn't matter. The connection is there. I have patients in my practice who will not see me. They'll walk in and ask, is Dr. So-and-so there? And if the doctor is not there, they'll go. They'll come back when that doctor is there. So when a patient is loyal to one dentist, they are not usually easily swayed, whether by price or even the availability of somebody else. They'd rather pay more and ensure the same type of service they are receiving. You know, we're all creatures of habit. We like to keep what we know, what we love. And this is something about the human being. We tend to be creatures of habit, and we tend to keep within our zones. Once you're comfortable, you don't want to move on. Now, the loyalty of patients is a result of, in this case, a dentist. In our case, a dentist is consistently meeting and exceeding expectations of the patient. When you talk about patient loyalty, the broader thing you look about maybe is something like customer loyalty. Why do you go to that same shop every time? I remember having an experience years ago when I used to go to the market on Saturdays. I remember in Nakasero market, there were so many women who were selling tomatoes, and they're all reaching out to you. Then I used to buy from wherever. There was a time when a particular lady treated me so well that I would skip 20 vendors and go to the same lady every Saturday. You know. Now that is out there in the market. I mean the real market, market. But the same things tend to happen even in where we are in our professions. And the one thing that really determines loyalty is the word trust. Trust. When someone gets to trust, and I think we can talk about this ourselves. When you get to trust somebody, when you get to like them, when you get to like their service, you'll find that you tend to go back again and again, just like the story of the market woman that I talked about. So if patients get to like you and there are things about that can improve that, or like your practice, they are more likely to visit again in the future. And this is important if you're doing dentistry as a business, even as a service, because as a service, your focus is not on money, but you're offering a good service. When you don't have happy patients, you don't have patients who are willing to come back to you and again, your business will not survive, or it will be very, very mediocre. So this is really critical to business success. And because it's so critical, we need to be careful that we don't look at short-term costs. Sometimes there's a temptation to get a short-term gain, but that can be very, very counterproductive. When you have loyal patients, it's good for business. They'll grow your organization, they'll grow your own work, and they make work profitable. Years ago, I saw a picture. They were talking to a picture related to question of corruption, and the person illustrating it was showing how, you got the well with a bucket full of holes. By the time you get home, there's nothing. The same can be said with trying to fill a basin or a saucepan which has a hole in it. The water, it keeps leaking out. Now, you can have a lot of patience, but if they keep going, then you find that you're depending on how fast they go, how big the holes are. You may find that at some point, you don't have anything left to hold in the bucket. So the goal for all of us as professionals is to ensure that we offer a good service. The rest is not to worry too much about. And in many cases for us, we are not really, our system doesn't allow us to market. So the marketing is not direct, it tends to be indirect. So we have to plug these holes. What are the holes that make our patients leave? Now, admin, someone's mic is on. It keeps making noises in the background. So please check if your mic is on, just turn it off. Now, one of the things about having loyal patients is that they are part of your capital. This is what's called goodwill. When you have goodwill, and often businesses, this is recognized in business, that if you're selling a business, there is an aspect of goodwill. That means that if you've created a brand, even when you're not there, people will keep coming because of the brand. And that is an unquantifiable thing called goodwill. And so the more goodwill you build, the larger the pool. It's an asset actually, and many of these patients become your promoters. They talk about you to other people. They refer you when you don't even know they're talking about you. And similarly, patients who have a bad experience decampaign you. And the sad thing about this is you do not know it's happening. It's happening somewhere. Someone asks them, would you know a good clinic to go to, or you know a good dentist? Don't go to this one. Now, you don't know at all. So it's important for all of us to know the things that augur well for loyalty. The issue of, I think of a very wise man, King Solomon, who lived many years ago, who said, a good name is better than gold or silver. I mean, he understood the fact that having a certain reputation name carries with it a certain aspect that is even more precious than the money itself. So there are certain things that we need to do to ensure that we can have this kind of goodwill as professionals. And if you're running a business, also. Having said all of that, I personally have I have people who have been loyal. I've lost patience, and I think I would not be wrong to say all of us have lost patience. Sometimes because of things we've done, sometimes because they're difficult, sometimes because of mistakes. And the thing is to learn from it, to learn from the mistakes that come, and then build on that to move on. No one on earth can satisfy everyone. You know, that's something you need to come to terms with. There are people you'll just not be able to satisfy. And by the way, I should also add that there are some people I'm as glad to see go as I'm glad to see come. Recently, I had a patient with Dr. Chapman, who I referred to Dr. Chapman, and they seem to be happy with Dr. Chapman. I told Dr. Chapman, I'm very happy. Please keep them. Don't bring them back. Keep them. Because there are some patients who, when you see walking inside into the reception, you know, things can get a bit stressful. So, but it's important to note that if you have a good base of loyal patients, that works well. It actually spins off on itself and begins to multiply in your favor. So, why do patients move on? And under this, I'm going to cover about 1, 2, 3, 4, 5, 6 areas, and then I'll look at some tips on building loyalty. Let's begin with you as a dentist, with me as a professional. One study that was done where they asked patients who had moved why they moved on. Some of the reasons that were given were, one, the dentist was not interested in me. They did not look interested at all. They just either were nonchalant or they seemed to be more interested in something else. So I didn't feel that they were really caring for me. Another one was the dentist was a poor communicator. Did not communicate. Did not tell me what to expect. Another one has to do with the quality of care. I did not feel like I was getting the best from the dentist. And then there's the issue of professionalism. In our dental school days, we were taught about, in fact, those days, I know it's still the same. We had to be smart, even if you had 1 or 2 shots, like nowadays. These days, there are many things around, but nowadays, things were tough, when we were in school. That was soon after the war. And so if you had 2 shots, I remember ironing my shots and making sure they're clean. And I may not have had too many ties, but the importance of being smart was really highlighted. And maybe some people don't mind, but there are those who look at you and they think, if this person can't take care of their clothes, how sure am I that I'm safe in their hands? Others talked about a patient having a bad breath. You of course these days you have a mask and all that, but when there is if the patient, not only bad breath but bad body odor, the patients can be put off. And by the way, that also has to do with the assistants. If you have an assistant who does not take good care of themselves, it's time to address that. Maybe you can get, if you're a gentleman or a male dentist, you could get some of your female colleagues or staff to address it. And this is something that I've done. When the staff member does not know what deodorant is or is not familiar with this use, I tell them, look, you need to do this. Otherwise, when you walk into the room, a certain order takes over. Also, if the dentist is too rough, developing gentleness is something that we all need to increasingly develop. Of course, all these things lead to one thing, that the patient have confidence in you. Part of what we're doing is building confidence. And if the patient loses confidence for one reason or the other, they'll move on. So there are dentist factors that lead to patients moving on. But there are also staff factors. Staff members being too rude or not being helpful or being treated rudely can also be on the phone. These days, we have an increasing number of patients with a good chip on their shoulders. In the days when we trained in the 80s, in the early 80s, really, those days when patients came, even if you tried to give them a treatment plan, they'll just say, those days are gone. Patients come, they are fairly knowledgeable. You know, USE has done some work, maybe not 100%, but these guys can use Google. They have some idea. And also the other thing that's happened now is that there are not many more options. So if the patient feels like they have not been treated well, they'll just move on. They'll look for another alternative. So being courtesy is one thing we need to learn. And I notice more and more that courtesy doesn't come naturally. Some people have had a very rough upbringing, and so they don't know the basic things that show that someone is respected. I remember one of my staff some time back, I had to teach her to say please. Please. I mean, otherwise they tell the patient, do this, do that, do the other, and for them it's normal. So courtesy, professionalism, those are things that can work for you or against you. And then conflicts. If there is conflict going on in the organization, this becomes more difficult as the organization grows. But if there is unresolved conflict, it creates an atmosphere. Sometimes assistants are having a go at each other, and or the doctor is having a go at the assistant. And people pick this up because they are patients, they are vulnerable, they may not say anything, but they pick up the tones of what is happening around them. And so it's important that in the surgery, we try as much as possible to maintain a calm atmosphere. One time I had a patient who came to see me who had left another clinic. And when we finished, the patient said, "Oh, I didn't solicit this. They just told me that, one of the reasons why I changed is because when I was in this place, the doctor was always shouting at the assistant." Now the doctor may have thought they were making a point, but the patient felt insecure. And she also added that I've had you use please with your assistant. Please do this. And for me, I was taken aback. I thought, wow, I mean, that's a reason why somebody can actually move. But that's the reality. Of course, it depends on who it is, but that's the reality. None of us wants to be treated rudely. None of us enjoys being in an atmosphere where there's conflict. If you went to any place, even if you entered a shop and the assistants were having a go at each other, you just want to leave or do what you have to do and leave. And the likelihood of going back there diminishes. So as professionals, and I've been a victim of this, there are times I've been very, very frustrated with my assistant that, I instead of waiting for the session to end, I have a go at them. But that's something to note. Now, the third major cause is financial. And that one, as again, wherever you set your rate, there will be people who can afford and those who can't. I mean, even if you went to work in the slum area and set certain rates, you will still have that, those who can and can't. And so sometimes you find patients find either the prices are too much, they'll move on. And talking about insurance, there are a number of insurance companies now. If there are issues with insurance, so patients feel like they have not been billed correctly, there was an error which was made and it was not explained to the patient properly, that is usually a bad sign because the patient might begin looking for another alternative. Or if the errors happen again and again, or fees show up on their bills that were not, they did not know about, they may begin to feel like, I can't trust this place, I can't trust. So clarity on billing is important. Clarity on financial policy when changes are made. Again, I've learned this through hard experience. All those things are important. Recently, we had an incident where a patient was paying with a card, and one of the staff, fairly new staff, made a mistake, and they added a zero to the payment. Now, this was by card. Now, fortunately, we discovered fast. So as soon as I knew I was asking questions, Have you called the patient? Have you explained? Fortunately, the staff had done it. They had seen the mistake, and they were the first to call the patient and say, look, we made a mistake. We are working with the bank to reverse it. And finally, it was reversed. But imagine a situation where that happens and the patient finds out. There'll be a lot of explaining to do. And if you're not fortunate, you might end up actually losing that patient. So the financial reasons are another. Then there's actual treatment. If a patient's treatment questions are not answered, if they felt like the treatment was too painful, pain control is very important. There are patients who say, oh, it's the first time I've had something without pain, or I've had treatment without pain, or now must this be so painful? So managing that these are things with our professional ability. In the treatment, do they have an adequate sense of privacy when something important is being discussed? There are times you may need to ask the assistant to move out, or even we usually leave our doors open. That's been a policy for a long time when we're treating patients. Our practices have doors, but we don't close them. But there are times you may need to close the door. If a patient tells you, I want to talk to you in privacy, they really mean that privacy. So that becomes an important aspect as well, the sense of being managed in a private environment. Now, I remember years ago, I had a patient who I'd seen for quite a while, and they visited me at a certain time when I was under so much pressure. Those were years of, there was a particular season in my practice where three of us working at that time, and then one person moved on, and the other person had family issues, and I was alone. And I was working like a conveyor belt. So the patient walks in, what is a... So one time, this patient was a good one, because most of them won't tell you. So one time this patient told me, Dr. Magara, I think you're too busy for us. You're too busy. And it really hit me. I mean, I've not forgotten that. It was a very, very big check. And I realized that actually I was now more concerned about finishing the schedule than actually listening to the patient. I didn't lose that patient, but I learned a very important lesson that people want to feel when they're in pain, they've come to see you to relieve their pain. They want to know that you're paying attention. And I have to keep checking myself even when I have a busy schedule. That thing stayed in my mind that, you people need to know that you actually are paying attention, even if you have to pretend that you're doing it. And the other thing is the patient is embarrassed. If you ask questions that are embarrassing or treat them, patients often come. They'll say, "Oh, I've done so badly. I've not been to a dentist in 5 years." Now, if you begin rubbing that in a negative way, much as they offered that they were in the wrong, if they feel like you're embarrassing them, they'll be too ashamed to return. Okay. Still within the treatment area, if there are any concerns about sterilization or cross-contamination procedures, those will be issues. And so it's important the operatory is kept clean as possible, and the standards differ. But if it is you working that surgery, remember, they will remember you also. They'll not just remember the clinic, they'll remember you. So that's something that to be paid attention. So things happening around the treatment area can be a challenge in causing patients to fail to come back. So let's go on to other things, the ambience of a place. This is very important, that as much as it's possible within your budget, make the place comfortable. When they walk in, they check. There are people, there's somebody I know who, when they go to a restaurant, the first thing they do is go to the toilet. And if the toilet is messy, they'll just walk out. They'll not even stay there. So, one time we're discussing this, and someone who had worked in the hotel industry said, "Oh, you should go to the back end where they cook from. That's when, in some places, you'll never go back again." But people are reading, I always have a fight in my practice with littering, either by patients or other people come around. You find that sometimes patients will walk out and have tissue and just drop it in the parking yard. Now, if another person is coming and finds the place littered, it sends a very wrong signal. If the reception is messy, it sends a wrong signal. I remember another experience I had years ago. I was renting premises at that time, and there was a leakage in the roof. And as a result of the leakage, part of the ceiling, which was a cardboard ceiling, began to cave in and eventually fell through. Now, this was really the responsibility of the landlord. And I was pushing it. I was saying the landlord must do this. They must repair the roof. They must sort out the ceiling. And for a number of weeks, this place was gaping, the reception. What I didn't realize was the impact it was having on my patients. One particular patient came to see me. They had come before and left, and then I didn't realize that they came. So they came back and they said, no, Dr. Magara, we came the other day, but when we looked at your reception and the roof, we just thought this was not a good place. So we left, but we decided to come back. And we had not sorted it out yet. I had to do what I had to do. I mean, I decided to just fix it myself and sort out things with the landlord later. So that's an example. It could be something else. So we need to have your eye open to look at the ambience within your budget. Make it a comfortable place to be, so that when people come in, they don't feel anything repulsing them. And of course, if you have toilets as well, which you should have anyway, just make sure that there's somebody who checks on them regularly, so that when people go there, they don't find it messy. These are things I still battle with on occasion. Now, about the location as well, sometimes you may find that a patient is more looking for a nearer place, either because they're getting old or transport has become too expensive or things like that. There are patients who one reason I read sometime about a patient leaving was that the doctor's office smelled like a dentist's office. I don't know what they meant exactly, but they keeping the place, making sure that orders are taken off, and that sometimes has with a suction machine and things like that, are things that can turn people off. Now, the other reasons, recommendations from other people, maybe my brother went to another practice and it was good, so can you come? These things happen. I've had patients who told me, oh, my wife went to such and such a place and they're asking me to move on, and some of them have moved on. They may move on because they hear there's technology in another place, and they move on because of that, or the issue of publicity. And this is something we have to pay attention to. It took me a while to get on social media, but I realized that eventually I had to. I mean, I was really more old school as these new things came, Facebook and so on. I just thought there's no point doing that. But you know what's happening these days, especially this young generation, the millennials, they will come and have a bad experience and they will put it all over. It's like they want to kill you. They will post it, they will write horrible stuff. Now, things will happen to all of us. You can't control everything. But being there and being able to apologize, being able to explain things, it really helps. So if you're not present, think again. But publicity, we are in a generation which is very conscious of social media. In fact, many people don't read papers anymore. They don't read newspapers anymore. They don't read books anymore. I think one of the benefits of the recent blackout of social media was that many people began reading books. I've talked to many people who said, oh, I started reading a book again, because social media takes so much of our time. So there has to be some presence, and just knowing what's happening there and having yourself present. Before I got online, I found people were looking for the practice. They couldn't find it. And actually, there are also crooks who went out there and set up a Jubilee Dental. They're trying to sell me saying people are calling us, we want to sell this to you. I realized I had to get present myself. Now, the other thing which is key is schedule. depending on whether you're talking British or American English. The American says schedule, the British says schedule. If people are kept waiting too long, it becomes a problem without explanation. I learned this very early in my practice when I didn't have many patients then. And so someone booked an appointment, and another one who had not booked an appointment came like about 10 minutes before the other one came. And so I decided to see the first and the second person. Now, the problem was that when I started working on the person who came in as a walk-in, the procedure got complicated. So I delayed the patient who had the appointment by about 30 minutes, and they were not amused. So they came, they really told me off, and that is something else I've not forgotten. If you've given somebody an appointment, try as much as possible to see them within that time. You will not do it all the time. There will be times when you'll be off, but there are times when you can manage it. If someone has walked in 5 minutes to an appointment, remember there's someone on appointment. And if they don't feel like you honor their time, they will also begin to behave that way. We are all like that. When we're in school, if there was a lecturer who was very tough, imagine what happened? Before long, everyone was submitting their assignments on time. If there was one who would give you 1 day, 2 days, you say, that one's okay. You do it late. That's how we are. And when patients learn that you delay them all the time, they will also come late. And I've had patients come and say, the last 2 times I was seen late. Why is it that now I'm not being, why is it that now I've come on time and you're not seeing me? Now the thing is, once you're tied to the program, you keep your time and you begin to actually train your patients. I've had days when and it's not very unusual that I get days with 100% attendance. Most times that's at least 75%, 80%, but 100% attendance on a full day is not unusual. And this is because people have learned. They know that if I miss him now, I'll not see him, for some time. And you tell them, look, you're late now, or we make you wait. So the way you manage your schedule is very, very important. Okay, so I want to just give about 6 or 7 points. Some of them I've already mentioned. I just want to emphasize them as we look at how we can increase loyalty. As I said at the beginning, loyalty is a brand that you build, and once you build that, it becomes a capital for you. You'll find that after some time, it won't happen immediately. I always tell the younger dentists, be patient. Be patient, but be consistent, because the time comes when patients will be looking for you. I've been surprised. There was a time I worked in Entebbe, like today I was working in Entebbe clinic. And there was a day I had all my patients coming from Kampala. They drive all the way to Entebbe to see me. But that has come over time. I mean, I've been in practice now. I graduated in 1988. So I've had over 30 years. But in private practice, it's our 26th year. We're coming 27th year. So I've had time to do this, and sometimes I find a great impatience in the younger doctors because you want to have everything happening yesterday. It will happen if you're consistent. That's the nature of life. Things don't happen overnight, but if you're consistent and you're doing the right things, it's just a matter of time that you'll have this kind of loyalty of patients. So number one, make patients feel very welcome. Make them feel comfortable, and there's some basic things. If someone walks into your reception and finds a grumpy receptionist, that's the first experience the patients have. Or they find at the reception, there's clutter going on, people are going at each other. Immediately, that's first impression. I've told my front-desk staff that you are the first image of Jubilee Dental. So if they don't get a good reception, that's it. And sometimes some patients will leave just there. They'll just say, I'll come back. In Uganda, they're not very, there are some cultures which are very confrontational. And that's it. You won't see them again. So as much as you can, let your front desk staff be able to welcome patients, to make them comfortable, and for them to be able to have a comfortable place. I remember when I was working on, when I began private practice in 1994. In 1996, I moved out of a group medical practice to actually establish Jubilee Dental alone. And I had a very small reception. So I remember one day, if you had 5 in the reception, it was full. And I remember one particular day, one patient came and the reception was full, and they said, "I'll wait in my car." And that's when I did not want to move, but the signals were very clear that it's time to move, it's time to get a different place. So make patients comfortable. That's the point I'm making. And then secondly, get a genuine interest in your patients. As I told you, with my own experience, don't rush. Again, don't get too much into their lives and you're asking questions that are embarrassing or uncomfortable. There's a bit of people skill that we all have to develop, so that you kind of gauge, and see how far you can go. But get to know them. When people become friends with you, they are less likely, even they're more likely to be forgiving, because you'll make mistakes. None of us is an angel. Maybe we have some on the platform, but you'll make mistakes. If when you make a mistake, patients will be more forgiving if they know that you care. If they do not really think that you care, they are more likely to be trouble. So take some time to know your patients, ask questions, and within the limits, And then get a good, make sure that when they come the first time, as much as is possible, new patients, those who are meeting for the first time, take time with them and start to create a good impression for them. I've already talked about the waiting room, where they wait from. These days we put away the magazines because of the COVID time, but perhaps it took me a while. I did not like to have TV screens. Eventually I succumbed. I've tended to use a lot more music, and even music, you have to choose your music carefully. It's been shown that some music actually increases pain. If someone's having a toothache and then you put on a rock band, the music will begin pounding in their heads, and the pain will increase. There was a study which was done actually, which shows that certain types of music reduce the perception of pain, and others increase it. And then I mentioned schedule. Try to keep your schedule. Remember, you're building loyalty. So if you've told the patient, "I'm seeing you at 9 o'clock," try and keep that as much as possible. If you keep shifting your schedule, you're actually building something else. They'll begin to know you cannot be trusted. You cannot be trusted to keep your time, and that can work negatively. You'll attract a different kind of patients. But if you want to attract good quality patients, then when you give them time, try as much as possible to keep that time. And you'll get feedback. Some of it will be good. We all like getting good feedback. Some of it will be bad. It will be nasty. And being able to receive that in grace and maybe ignore it or look at what you must do to change, I think it's something that is would go a long way in getting you or getting us as professionals to where we ought to be. I'll just say one final thing, and that is honesty. People read through things. Human beings are not stupid. They may not know, but if people find that you've been dishonest with them, you'll have lost them. And you don't have to look for it. Just look at yourself. How did you respond to that shopkeeper who did not tell you the truth? Or how did you respond to that service provider who told you one thing and they did the other? How did you feel? Let's not forget that these feelings and reactions are common to all. And if people have a sense that you're not honest with them, you'll have lost them. So really, to recap, and I do hope we have time for discussion, because I'm pretty sure that all of us have experience we can share, and many of you have been working for a very long time, and you may have stories, anecdotes that you want to share. But just to recap as I conclude, patient loyalty is it's an asset. It's an asset, and when you've developed it, you'll find that people will overlook a lot of things just because they want to see you. As I gave the example, I've been really surprised by my patients who drive all the way to Entebbe to see me. Say, "Oh, okay, you can only see me in Entebbe, so I'll come to Entebbe." And that is something that we'd all want to have. So build that asset. It's a capital that you have to build. And once you have a good amount of it, you will not be worried about advertising yourself because people will be looking for you. Be mindful of the things that make people move away. I've given a number of them here. And let's all work on building loyalty. I'll just say once again that we don't have to, okay, they usually, I don't like the word competitors. It's used a lot in business. Well, while it may be true that they are competitors, in Uganda, our situation is we're different. We have very few dentists, and we can all do a good job of giving good service. Just remember, you can't treat everyone. If you were, you'd be the only person working in the city. There are going to be a lot of good practices coming up, and if we all do our work well, it will just enhance the advance of dentistry. So thank you very much once again for your attention, and I'd like to hand back to the moderator. I hope the moderator is available now, and to guide us through a discussion. Thank you very much. Is it Dr. Matovo? Hello?
Hello,
is there anyone out there? Sometimes in these platforms, you can be talking to yourself for a long time. You don't know. I hope I didn't break at any point.
Dr. Magara, thank you for your pearls of wisdom. That's a great experiences you have shared with us. I think Dr. Mutovu is a bit tied up, looks like, but we are willing to entertain some discussion. If there are any participants here who would like to ask questions or share their experiences, please, we can go ahead. Is there anybody? Yes, by the way, yeah, that's true. The amount of patience and loyalty, it's tremendous once you have built that. I've also had the patients flying in from Kenya where I try to advise them that there are dentists there and you don't really have to fly all the way down here just to see me, you know. But that's what loyalty is. Yes, and we need to build all that with everybody. Anybody for any more discussions or questions, please go ahead.
I see Dr. Maria has her hand up, so maybe
yes,
Maria.
Dr. Maria, please go ahead. Thank you.
Thank you, Dr. Magara, for the presentation. I'm not so sure if I'm clear, but my question is as regards keeping patients, because sometimes you still offer quality service, probably create a good rapport with the patient. You expect a good relationship, but probably the way you look or you appear, your age or something, and they just get disconnected. So much as we can't be perfect, but at least we always want to strive to be there. And you realize that some actually prefer older dentists, male dentists. So how can we work that out to retain our patients?
Okay, thank you, Maria. There are factors that you can handle, and there are some that are beyond you. I would say you have to work with what is within your means. If someone doesn't like a lady, they don't like a lady. And what can you do about it? Or someone thinks you're too young, they think you're too young. What can you do about it? Maybe if they had a chance and they gave you a chance, then you really have to show them that you're just as good as any. So you will not please everyone. I think that's one point I made, that it's impossible. I don't think there's anyone who will 100% please everyone. We all have our preferences, prejudices, and so on. But just be consistent. There are those who will believe in you. That's where you start from. All of us started as young dentists. I worked under Dr. Chapman, and then I began my practice. There were many other practices. There were not very many at that time, but there are a number of practices that were already established and known. I started from nothing. I saw one patient on my first day. I was even lucky to see one patient. There were 1 or 2 days I didn't see anyone. But you see, because we don't advertise, it has only grown from presence, from word of mouth. I mean, to the thousands of patients I've seen. I mean, 30 years, you can imagine. I think I've probably seen tens of thousands of patients over this time. But you start. You start from where you are. So for those of you who are starting off the blocks, I just want to encourage you. It takes time. And that's what we need to appreciate. We live in a world that wants to get things overnight. Life doesn't happen that way. Things grow slowly. Plants grow slowly. Relationships grow slowly. And if you look at friendships, they also don't just happen overnight. It's very rare that you meet someone and then you hit it off as friends. Those who are your true friends, you may have liked each other, but it's through time, through experiences that you develop this. And it's the same with the patient loyalty. You'll be tested. There'll be situations where you'll be tested, and things will happen. Be honest with the patient. The patient had a feeling done, and something went wrong within a certain period of time. So they come back to you. You're going to charge them again. They may not say anything. When you show them, say, look, because this has happened in this period of time, I'm going to do this again. I'm not charging you. I mean, there are small things that go across to communicate. And once you do that, you're building loyalty. So I think, Maria, that's what I would really say. It's impossible to please everyone. And actually, it's better that some people leave. There's some people who they stay will become a problem. But if you start with what you are, where you are, and you're faithful, and you do a good job with those that believe in you, they're going to build. And as time goes on, the younger dentists will become the older dentists. It's just a matter of time, and I'm talking about years. That will happen. Yeah, that's what I would say about that. Is there anybody else who wants to share an experience? Is that Geoffrey? I think Geoffrey's hand is up, or Joffa. Please go ahead, unmute.
Good evening.
Good evening.
Thank you, Dr. Magara, for that very informative presentation. I'd like to add one or two things, and thank you all for participating in our very first CDE in 2021. One is that also please be sensitive of cultural differences. Some of our patients, especially those from the more traditional Muslim cultures, people from the Horn of Africa, or even from Northern Africa who are Muslim, traditionally Muslim, you will find that the female patients may come with a male companion, someone who may even be younger than the patient. So please be culturally sensitive. You're going to be talking to the patient, but through the male companion. You're going to be addressing your issues through the male companion. You're going to be asking permission to touch the patient. Please be aware that there should be another female in the room in order for you to at least have some sort of defense. Also, in a way to also request maybe the female to be the one who may do or ask certain questions. That aside, there's also the issue that you raised, Dr. Magara, of technology. People may drift away from your practice because of, they've had, or some other practice may have some technology that your practice may not have. If you do a very good job and you have built that brand loyalty with them, sometimes they come back. They go for those investigations, and then they come back for you to do the dentistry. So don't let technology intimidate you and think that it will result in your practice, like a lot of flight of patients. But also, you have to try and keep up. You cannot try and practice 2021 dentistry using equipment and technology of the 80s. So if things have changed in our profession, and so we need to also catch up with some of the technology that goes with it. Thank you. That's all I have to share with you today.
Thank you very much, Mr. President. And thank you. Very important thing about culture. Fiona, Dr. Fiona's hand is up.
Thank you, Dr. Magara, for the presentation. I don't know if I'm loud enough, but I want to just tell you about my experience. There is a clinic yes?
Go ahead, you're loud enough.
Yeah, there was a clinic I was working in, and then a patient walked in and told me, "Doctor, before you see me, may I please see your sterilization room?" So they really asked me to show them the sterilization room, and they told me, if you don't show us the sterilization room, you're not going to work on us, because there are some people that sterilize their things and we are very keen. So that was an experience. Yeah, maybe we have something to learn about that. The second experience was, still I was in another clinic, and a patient walked in. So it was time to start the treatment procedure. And the patient told me, "Doctor, wait, how come your instruments are not in pouches like the rest of the clinic?" Because we used to store them in a metallic dish. And they felt like, "No, you can't work on me if your things are not in pouches." And that patient actually left the clinic. And they went just because of that. I tried to explain, like, this is also another storage, this is also another way of storage, this and this, but was like, "No, I don't believe in that. I need the ones that are in pouches. There, I know they are from sterilization, from the autoclave." So they just left like that. So I really think that because these patients, when they come in your chair, some of them, their eyes are always moving around. Where you're picking your instruments, they want to peep and see, is the place clean? How are they being stored? Yeah, so that could also lead to some of the challenges that we may get, especially in retaining our patients. So I just wanted to share my experience, and that's all.
Okay, thank you very
Yeah,
much. Thank you, Dr. Fiona. That's an important point. I mean, I'm having a challenge with my chairs, some of my chairs. And I remember some time back, a patient came to one particular chair that was not working well, and they had to keep sitting up to use the sputum. And at the end, they said, by the end of this treatment, I've done my gym work for the whole day. So things like that play, equipment. As I said, right now I'm having a challenge. Quite a bit of my equipment. I'm trying to make sure that they're replaced. Yes, and of course sterilization is a concern. But many of them may not say it. But if there are other things that raise the question, of course, a patient walking to the sterilization room, unless they have a medical background, they'll not know what is going on there, even if the room is clean. But they want to have that sense of assurance. But that tells you if they can do that, they're looking at so many other things. Like my patients who are looking at the roof. I never made a connection between a part of the roof which was leaking and that turned brown, and a patient walking out of the practice. So that was a learning point for me. Thank you for that, Fiona. Any other experiences or comments or questions? Yes, Mr. Roper.
Doctor, thank you for yes. Mrs. Roper. It's okay, Doctor. Thank you for the informative presentation. I would like to add on Dr. Fiona what she told. Doctor, these days at the present situation, COVID, you find patients walking in who are really hyper and more conscious, asking you questions like, is the reception sanitized, the chairs are sanitized? If you tell them yes, still they want us to do it again. I don't know how, can you give us some few suggestions on how do we handle such patients and such questions coming up?
Well, if they ask you to do it again, do it again. we had an experience at our practice, or when we are this whole thing of implementing SOPs, and some of our staff, while the doctors and chairside have been using masks all this time, and they're more used to using masks. Some of our other staff are not. So when we began, at some point, the reception were not wearing masks, and we've had patients come and tell us, few people, your reception people are not wearing masks. Are we safe here? Of course, those things are always they ring a bell, telling you, there's something that you're overlooking. So yes, I think it's a valid thing. Remember the person you're serving. Why does your clinic exist? Why do you exist as a dentist? Why do you have another practice? I hope it was to provide service. And if it's provide service, and in the process of providing service, you also make an income, then the question about service is that there must be a customer focus. Customer focus means you're addressing what the patient is looking for. A common thing when dealing with customers is to address what you are looking for, what you want. But if the customers are looking for something, pay attention to it. Otherwise, you lose them. So it's a point. There are people who are hyper. And actually, COVID, I think, has helped us as dentists to really up our game. I hope it has for you. It has helped us to up our game. Washing hands, all this stuff that we've talked about, and sometimes we've not been doing very religiously. We now find that because of COVID, it has helped to up our game. But if a patient is asking for it, give it to them as much as it's possible. Of course, there are times when they're asking for the impossible, but give it to them. So, and you'll soon get to know who those patients are when they come. Maybe next time they come, you should have someone ready with a spray bottle. Before they sit down, you do an extra cleaning for them. That's what I would say.
Yeah, doctor. Thank you so much. Yeah.
Fiona, your hand is still up. Did you just forget to put it down?
Yeah.
Sorry, I forgot. Let me put it down. Thank you.
All right. If there are no more questions, I'll just hand back the moderator. I don't know if it's back now. I was a guest speaker, so I'm not the right person to take the meeting to the next point, either the vice president or to somebody else to take on the meeting. And once again, thank you very much for the opportunity to share. And
thank you very much, Dr. Magara. We have really appreciated and learned a lot from this CTE. And I think we can now conclude that there are no more discussion points to be held. So thank you very much, and let's hope we can hold very many more CDE meetings with you, sir. Thank you. Good night, everybody.
Thank you.
Thank you.
Good night.